As more cases of COVID-19 are being reported in the state and in Northwest Arkansas, we want to keep you as informed as possible. Joining us once again, Dr. Gary Berner with the Community Clinic of Northwest Arkansas. Dr. Berner, thank you so much for taking the time to speak with us today. We saw perhaps maybe one of the biggest increases yet in COVID-19 cases during the last 24 hours or so. What are your thoughts about that increase?
Yeah, I saw that as well, and obviously concerning. I hate to say it, but I think that that's likely to become more the norm. I know we're trying our best to social distance and to limit contact with each other and for hand hygiene, but all the models, that are given to us in terms of what the next few weeks are going to look like, that may unfortunately start to become more the norm instead of the exception.
Is there any truth to COVID-19 affecting more people with type A blood than other blood types?
So there was an initial report out of China with only about 2,000 patients, and that may sound like a lot, but for those kind of studies to really have a lot of what we would say is validity or take a lot into it, we would need many more patients studied than that. There's a lot of reasons that those numbers could get skewed one way or the other. So it's a possibility. I think it's something worth monitoring, but it's not something that I would focus on right now. Instead, I'd take our focus towards really being and taking great care for anybody with an immunocompromising condition like diabetes or lung disease or heart disease. Those are really the folks right now that we know we need to have extra precaution for. Can they find a way to limit themselves from going into work and certainly limiting their social exposures?